forthwith. Honourable Turia.
I move that the Excise and Excise equivalent duties table tobacco products amendment bill be now read a second time. Mr Speaker, this bill heralds one of the most significant developments to take place in the public health system of this country. This bill is about saving lives, and I am humbled and greatly heartened by the support of parties throughout the House on this immensely important day. 118 votes out of 122. I greatly appreciate the strength of support that has come through this debate. This move will put the price of cigarettes and roll-your-own tobacco up enough to save hundreds of lives. Our most preliminary estimates expect that there will be 300 fewer premature deaths a year as a result of tobacco excise increase, rising to 500 fewer deaths a year by the year 2031. This is a development which is well overdue. I am reminded of the results of a survey from the Ministry of Health just 2 years ago that 80% of New Zealand smokers said that they regretted starting to smoke, and if they had their time again, they would not smoke. This bill is for them. The price increase will give them an added incentive to quit and a huge incentive to all of our young people to never start. This bill is an investment in the future of our country. I've read over some of the submissions presented to the Māori Affairs Select Committee inquiry held over the course of the last few months. The challenges laid out there are inspirational. There has been talk of people wanting to live in a smoke-free nation, to take up the opportunity to be world leaders in countering the global smoking epidemic in this land. There have been some amazing examples shared of people trying to make a difference in their own way. There are stories which demonstrate the power of whānau, celebrating the impact of loved ones, providing the incentive to quit. I have to admit that many years ago when I was courting my husband that I had the occasional cigarette. And George told me in uncertain terms that I had to give up, and such was the power of love at that time that I did it. It was an extremely effective strategy long before the days of nicotine lozenges and patches. There were many such powerful incentives shared by those who had the courage to give their stories to the Select Committee. In Hokianga, the word is out that if rangatahi want to be part of Wakaama, they have to be smoke-free. At the Pacifica Festival held every year, Pacific Heartbeat promotes the message of smoke-free, ensuring that every person who attends that celebration leaves their cigarettes at home. But there are other stories that simply made me want to weep. One of the most traumatic stories was told from Lloyd and Hinga Few. They shared the profound sadness within their midst, that within their mother's line, 14 of the 16 siblings have died of smoking-related diseases, leaving a void that will never be filled. Their submission spelt out in black and white the ghastly reality that cigarettes kill 1 in every 2 long-term smokers. This afternoon, right across the House, we have declared our condemnation of smoking as the biggest single cause of avoidable death and disease. The purpose then of this legislation is very clear. This is all around the issue of psychological triggers to quit. We know with smoking that most people who quit smoking still need to make several attempts before they succeed. The second distinguishing feature of this legislation is the substantial price increase for roll-your-owns. The government has decided to equalise the excise duties on a weight-by-weight basis so that all smokers face the same financial incentive to quit. In effect, the excise on loose tobacco will rise by 24% immediately, followed by the same 10% increases in 2011 and 12 as for cigarettes. Loose tobacco accounts for about 1/3 of all tobacco smoked in New Zealand, and we have one of the highest rates of roll-your-own use in the world, hardly something to be proud of. It should be known that the taxation of loose and manufactured tobacco products was last equalised in 1995. Since that time, the proportion of smokers using loose tobacco has increased from 28% to 50% today. As well as that considerable jump in numbers, I want to let it be known that users of loose tobacco tend to be younger, of lower socio-economic status, and are Māori or Pacifica peoples. These groups are the most sensitive to the price of tobacco products and as such are the greatest users of loose tobacco. It is to prompt people to stop smoking, and I want to talk to two particular aspects of this legislation which warrant further explanation. The first is the rationale for why we are not bringing the price increases all at once. As a government, we've been concerned about the financial impacts of the changes on low-income households where smokers may in fact struggle to immediately cut down or quit. As a consequence of our concerns, we decided to phase the increases in to give people more time to adjust. But a word to those who might suggest that these increases might hurt low-income families in particular. Of course, the well-being of our most vulnerable New Zealanders will always concern us, but where is the evidence that their well-being is enhanced by picking up a cigarette? A far bigger concern for the family members of low-income smokers is the harm that is done through the premature death of a smoking parent, the decline of household income through the smoker's ill health, the health impacts on their children from their exposure to smoke, and the health impacts on their children yet to be born when a mother smokes when she is pregnant. It is also noted that in phasing in changes, frequent price rises are likely to be more effective than less frequent, larger rises. A particular concern for me is that 61% of smokers who are aged 15 to 19 years report smoking roll-your-owns. The research tells us that young people are less likely to try smoking if the cigarettes are seen to be too expensive. Finally, I want to extend my genuine appreciation right across the House for the vision, the leadership and the solidarity that's been expressed. It has been an extremely moving debate to see parties come together in our commitment to a healthier future for all our peoples in this land. I want tonight to place on record my gratitude to all of those smoke-free champions, the advocates and analysts, the Oahi Kore providers and the researchers. This bill has also benefited from the dedication of officials in Treasury and Customs and the tobacco team, especially in the Ministry of Health. And my last word goes out to all of those mokopuna out there who today tell their parents not to smoke, who carry that message with such pride and vigour, and they remind us that when one woman dies, we lose an entire generation. We owe it to our children to pass this bill. Nā reira, ka mate te wahine kotahi, he waka tupuranga ka ngaro I te tirohanga kanohi ki te pō uriuri, ki te pō tango, mā te wahine kotahi ara, anō te rau waka tupuranga koia nei te pūtake o tēnei piri, koe ke panuku, koe ke tangaro, haere mai te toki, haumi e, hui e, tai ki e.